All right, so we're going to go over one of the most common exercises we often end up needing to use with patients with hip pain. Now, this is typically for people who have hip pain locally. It's what we call the C sign, where the pain is oftentimes right here around the joint. A lot of times patients will literally hold the hand right here over top of the joint when it's a legitimate hip issue. A lot of times people will come in thinking that it's a hip problem when they actually have more back pain, or the pain might be up here towards the SI joint or even radiating down towards the hip, but the pain is localized around the hip. A lot of times that's more of the low back origination of pain, not so much of the hip. Today, we're going to talk more hip, oftentimes that C sign type shape, or even some people just have more of a restriction, limitation, stiffness into that hip. So Storm, what we're going to do is we're going to go down onto your left knee with your right foot forward. So the most common exercise here that we end up having to do is just a hip extension here and kneeling. We tend to use this kneeling position because the hip is really designed to be a load-bearing, weight-bearing joint, and it tends to respond best in this hip extended position. So we're going to actually have you kick your front foot forward a little bit more. The biggest mistake that people have with this exercise is actually bending from the back. So we're going to be very diligent. I want that front side of the pocket, that front side of the hip to come forward, not the belly button coming forward. So drive your knee and that front side of the hip forward. Good, stay nice and tall as you're doing it. He's doing a really good job here of not creating all of the extension from the low back and really isolating it into the hip. Good, and then come off of it. Go ahead, give me a couple more reps here. It's not uncommon for people to feel a lot of that tightness and stretch here on the front side. That's exactly what we want right there on that front side of the joint. Now, I don't want that stiffness in the back once again, and this is a little bit different from a lot of the stretches that people will do for the quad. So I don't want the foot up or anything like that. That would target more of the quad. For Soren, we're actually going to progress him to the next phase of this exercise. So we're going to go forward, and then we're going to take your hand on your hip and just give your hip a little bit of push straight forward to really get him to his end range of motion. Good, and come back. Now this is often the most common exercise we need to do because we spend so much time in hip flexion. Keep going there, bud. And hip flexion, so when we're sitting, a lot of those kinds of things, we get stuck in that static hip flexion range of motion, and this is the most common range of motion that we need to do. So if you're having a little bit of stiffness in your hips, go ahead, give this exercise a try. You may need to add in a little bit of that pressure at the end as well. Big thing, once again, is making sure that it's the hip coming forward and not the belly button or the low back, just extending through the low back. Go ahead, give that a shot at home. Get your hips a little bit healthier today.